Even though overall the body is undergoing vasoconstriction of blood vessels so that the blood pressure increases, there will be some vasodilation throughout the body so that more blood will flow to certain parts of the body, such as the muscles. The muscles will get increased blood flow. We may even signal the muscles to begin their contractions in preparation for the fighting or the flighting that we will have to do during this emergency or exercise. And so we may look tense as our overall degree of muscle tone increases. This will prepare us for fight or flight.
When we are at rest and it's not an emergency, we don't plan on having to sprint or to fight anytime soon. So we can decrease the overall tension in the muscles of our body, since we don't plan on any fight or flight anytime soon while we are at rest.
If our muscles are going to break down the foodstuffs to get energy, they're going to need oxygen. So that means the lungs are going to have to work harder. The respiratory rate will have to increase. We'll have to take more breaths per minute. We will have to dilate our respiratory passageways. This is known as bronchodilation, and this will cause more air to flow into the lungs. And so therefore, during an emergency or exercise, we will increase our gas exchanges so that the muscles can get rid of their carbon dioxide and get more oxygen. This is what the sympathetic division will do during the fight or flight response.
Our muscles are not producing as much carbon dioxide as they would during exercise, and their oxygen needs are less. And so as a result, our respiratory system does not have to work quite as hard. Our respiratory rate can go down. The respiratory passageways do not have to be open as wide. They can undergo bronchoconstriction so that less air needs to pass. And so during the parasympathetic's rest and repose response, the respiratory system does not have to work quite as hard.
If the muscles are going to have to work very hard to fight, they're going to need energy. In flight, we will need energy. And so the liver should break down its glycogen stores and put glucose into the blood. Fat cells should break down their triglycerides and release these products in the blood. So our muscles should have access to the energy molecules that they will need to contract and to power our fight or flight response during an emergency.
When we are at rest, we can store energy in the liver in the form of glycogen. We can store energy in the form of triglycerides in fat cells. We are not releasing them into the blood the way we would if the muscles needed this energy during an emergency. So during the parasympathetic division's rest and repose response, we can be storing energy throughout the body.